Hey guys, this is Dr. Hub. Today we are looking at some psychiatric emergencies. So under psychiatric emergency, we are going to see the fever with altered mental status. Fever with altered mental status. So in a clinical setting of fever with altered mental status, we are differentiating them. So the first one we'll be considering it as a neuroleptic malignant syndrome. Neuroleptic malignant syndrome. So under this, first we need to know what is the cause of this. So the cause is nothing but there is a dysregulation of the dopaminergic pathways. There is a dysregulation of the dopaminergic pathways. Dysregulation of the dopaminergic pathway. Next comes the fever and altered mental status. Fever and the altered mental status. So this is present. And what about the muscle tone? The muscle tone is rigid. So what about the skin and the mucosa? The skin and the mucosa, they are wet. Then pupils, they appear normal. So what about the bowel sounds? The bowel sounds, they are normal. And looking at the reflexes, it is a bradyreflexia. There is bradyreflexia. So how do you treat the neuroleptic malignant syndrome? So the treatment, if you see, the treatment is by stopping the antipsychotic. So you stop the antipsychotic, and what we administer is stop antipsychotic and give the dantrolene. So we administer dantrolene, then the bromocriptine, dantrolene bromocriptine, as well as you monitor the CPK levels. CPK level monitor, we monitor it. Next, we will move on to the other disorder, that is a serotonin syndrome. So what happens in case of the serotonin syndrome? So first we are going to look at the causes. So the cause is that in terms of serotonin syndrome, it is a co-presentation. So there is a co-presentation, and this is of the MAO as well as the SSRI, leading to increased serotonin and norepinephrine levels. So this leads to an increased, so it leads to the increased serotonin and the norepinephrine levels. So this is the cause. So what about the fever and the altered mental status? So the fever and the altered mental status, this is present, that is, it is positive. Then when we look at the muscle tone, it is rigid. The skin and the mucosa, it is wet. So what about the pupils? The pupils is normal. It was normal in neuroleptic malignant syndrome. Here it is dilated. The pupils are dilated. Then when we look at the bowel sounds, the bowel sounds, it is increased. So what about the reflexes? The reflexes of the serotonin syndrome is increased. Then we look at the treatment. How is the treatment? The treatment is that the change in the drug gives a cyproheptadine. The change of the drug gives the cyproheptadine. There is cyproheptadine. Next, we are moving on to the anticholinergic syndrome. So AAC syndrome, anticholinergic syndrome. Here, what is the cause of this? The cause is that it is a anticholinergic intoxication. Anticholinergic, there is intoxication. So what is the fever and the altered mental status? So here it is present. Then the muscle tone here, it is normal, whereas in case of the serotonin syndrome and the neurological malignant syndrome, the muscle tone was rigid. Here it is normal. Then when we look at the skin and the mucosa, so the skin and the mucosa is dry here. So we see some changes which are occurring in the anticholinergic syndrome compared to the neuroleptic malignant syndrome and the serotonin syndrome. Here the muscle tone is normal, the skin and the mucosa remains dry. The pupils, it is similar to that of the serotonin syndrome, that is the pupils are dilated. Then what about the bowel sounds? The bowel sounds in terms of the anticholinergic syndrome, the bowel sounds are decreased. Whereas in case of neuroleptic malignant syndrome and the serotonin syndrome, it was increased. Now the AC syndrome, it is decreased. The reflexes here is normal. Next we will look at the treatment. So what happens in case of the treatment? In case of the anticholinergic syndrome treatment, we discontinue the drug. So what we do is we discontinue. So discontinue the drug, and we also administered the IV physostigmine. So we administered the IV physostigmine. Then we move on to a condition known as the malignant hyperthermia. So what is happening in case of the malignant hyperthermia? So in this case, the cause is that the halogenated anesthetics. So halogenated anesthetics and the succinylcholine. Halogenated anesthetics and the succinylcholine, they lead to a hypermetabolic response. So they give rise to the hypermetabolic response, and this causes increased intracellular calcium levels. So it increases the intracellular calcium levels. Then we move on to the fever and the altered mental status. So the fever and the altered mental status. So here it is present. And what about the muscle tone? The muscle tone in terms of malignant hypothermia is rigid. Then we move on to the skin and the mucosa. So how different is the skin and the mucosa? So skin and the mucosa, it is wet. The skin and the mucosa is wet. And what about the pupils? The pupils, it appears normal. And the bowel sounds? The bowel sounds, it is decreased, and the reflexes as well is decreased. So bowel sounds and the reflexes both are decreased. So how do you treat this malignant hypothermia? So the treatment is by cooling. So we do cooling, then there is dantrolene. Cooling, then there is dantrolene. There is insulin and glucose as well as glucose. So cooling, dantrolene, insulin and glucose. So this was about the psychiatric emergencies, and we saw the fever with altered mental status. To learn and grow daily like this, please do subscribe.